When you're gone, how would you like to be remembered? Think about it. Living through a global pandemic means that our shared experiences will become a page in a history book one day. Since the very beginning of the COVID-19 crisis, museum curators have been working to preserve the realities of the past 17 months, a time that many Americans would rather forget for now. One of these historians is Alexandra Lord, the chairman and curator of the Division of Medicine and Science at the Smithsonian National Museum of Natural History. She's been spearheading the museum's efforts to collect COVID-19 related items. Looking back, Lord says the museum failed to save many artifacts from past pandemics, like the 1918 Spanish flu.
So one of the really interesting things that's happened with the pandemic is many people have asked us, did you document the 1918-1919 flu pandemic? What do you have from that pandemic? And the answer is we actually don't have anything. So you can see how easily when a tragedy, an outbreak occurs, it becomes very difficult for us to think about collecting because we're wrapped up in those events.
That's why Lord says it's never too early to start preserving an important event. Waiting until it's in the rearview mirror can rob future generations of the chance to understand what this time was like. She says COVID-19 was on the Smithsonian's radar even before the U.S. declared it a national emergency, much less a global pandemic.
We actually began thinking about collecting around COVID-19 very early on in late January. We're historians of science and medicine, so we follow what's happening in science and medicine today, not just the past. And medical experts and public health experts have been saying for years that a pandemic was looming. So we have often looked at events that are unfolding that relate to disease and outbreaks and epidemics and thought, is this something that we should begin to document?
Historians at the Smithsonian began conversations with public health officials in early 2020. By late March, the museum formed a task force across several departments and began compiling items and stories. Lord says early in the pandemic, people were already offering to donate their masks. Homemade masks, decorated masks, masks worn by healthcare professionals or kids. Lord saw them all. The range of objects eventually grew outward to include COVID-19 related Halloween costumes, art projects, thermometers, and calendars that people created to mark the pandemic.
Along with those sort of everyday objects, we're also collecting objects that really document the scientific and medical story as well. So we have collected, for example, Dr. Fauci's COVID-19 virus model that he used in the White House, but we've also begun to think about collecting around testing that occurred, also vaccination as well.
But what items best symbolize the many months of lockdown? Museum curators aren't the only ones grappling with this question. Kevin Mitchell Mercer is a professor at Valencia College. At the start of the pandemic, he was teaching history at the University of Central Florida. Mercer went viral for asking his students to write about one artifact from their lives that a historian could use 100 years from now to understand the COVID-19 crisis.
We often, as historians and even history students, will look at artifacts, sort of look back at them and say, what does this tell us about ancient Rome or something? With this, I wanted to have them think about their experiences, but articulate them sort of forward. And so I've often used this assignment, but as COVID happened to all of us, we shifted. Everything shifted quickly. And I found that my students were reaching out to me and they were struggling. They didn't really understand what was going on. And this is the beginning of the pandemic. They didn't know what to do. They didn't know how to even understand any of these things. And their lives were just in such chaos. And I thought this could be a way for them to kind of think about their experience in maybe a more perspective way.
The college students had one rule for the assignment. They couldn't choose masks or medical equipment as their topic. Mercer wanted them to dig a little deeper. The final essays included a variety of items like a glass door between loved ones, half-empty notebooks, and messages from one student's mother as she left for work as a nurse. Many entries focused on items that symbolized the sudden end to in-person classes and campus life.
Imagine setting your dorm room up, setting up your college apartment, putting up posters and buying IKEA furniture with your mom and dad. That whole experience that so many people had all of a sudden became this sort of frantic packing experience where they didn't get to say goodbye to their roommates. They just sort of like left the keys in the dish on the counter and left with their room in a box or in boxes. And that was just so heartbreaking to imagine. Some people didn't even take everything. Like, and I left the furniture behind because I knew I didn't need it at home. I didn't have room for it at home. And you're like, just imagine those sort of empty apartments as kind of these abandoned places where they were learning things.
Natalie Nugent is one of those students whose college experience was put on hold. She's a rising senior studying political science at the University of Central Florida and was in Mercer's class. She chose to write about a graduation cap and prom dress, events that many young people missed out on due to COVID.
It's really interesting because a lot of people are just like, oh, it's just prom or it's just graduation. And, you can get that anywhere and it's just a dress or anything like that. But it felt really unfortunate that they never got to experience the normalcy of that throughout their entire high school career and what they were really looking forward to. So it felt like they were missing out on something big in their childhood. So I thought reflecting back on that and understanding, of course they didn't die, nor they got infected. And of course they didn't get to those extremes, but they were still affected in a more emotional and, I guess, social aspect.
The pandemic affected each person differently. Some missed out on life events, lost a job, while others struggled with loneliness and grief. How will we tell the story of COVID-19 once it's over in a way that includes the many perspectives? Mercer says he thinks future museum exhibits could be interactive by using windows, empty dorm rooms and shops, political masks, and new exercise equipment to show how millions coped with change and loss.
I think could be very, very moving. But I think they would have to really just open up the future's idea of just how transformative this time period was. And I think that would be the artifacts that I would want to make sure I found, were the ones that just explained that there was a day somewhere in the spring, and I don't think it's all a little bit different for all of us because it sort of did move across the country in different ways. There's a day where things were one way, and then there was a day where things were different. And as we know now, we haven't really gone back. As we talk on via Zoom, and something I would have never done years and years ago and never even thought to do.
Lord believes she'll be working with COVID-19 artifact collections for the rest of her career. Her work is important not only for the museum's exhibits, but for behind-the-scenes research. And as for what the exhibits will be like, she already has ideas.
Well, I definitely think I mentioned the idea and the fear of touch, and that was so prevalent in the beginning of the pandemic. Now, of course, a year later, that is not something that really shapes us. So we want to document and tell that element of a story, something that appeared and was extremely strong in shaping how people felt about the pandemic and the worries they had, and then disappeared.
So, if Lord could add one piece from her life to the exhibit, what hypothetical artifact would she choose?
I lost my mother to COVID in May, so very early on. So I would obviously pick an object that related to my family's experience. Like many Americans, I lost someone. And I think it would be very hard to choose an object, but I would say that she was in an assisted living community. The staff were incredible and wonderful. And so in many ways, I'd really want to document what the staff did, some of the objects that they used to help protect themselves and to help protect individuals in those communities. I think those stories have not been told as much.
And how would Mercer respond to his own artifact assignment? He says he would share his last lecture of the semester that he never got the chance to give.
Whenever I give a last lecture for a class, I always cater it to that class, that group of students, their experiences, where they're at. And it's not often that different, but I want it to sort of feel very personalized. And so I have that kind of lecture every time, and I love it. And I save them and kind of know who they were, and I kind of write the class number on it so I can kind of reference back. And I never got to write that lecture. This group of students, I wrote them a quick email at the end of the semester saying, before I graded their final exam, so I really wasn't even saying goodbye yet. But when I give that lecture, it usually brings a moment where at the end of the class, students come and shake hands, or I had one student print a 3D Abraham Lincoln for me after a 3D printer. Little moments like that that make these sort of teaching moments so valuable for me, because those little moments were all lost. They were all lost, and that hurt me kind of. It didn't hurt me in a way that. It just made me sad. It just made me so sad to think that I didn't get that moment with them, and they didn't get that moment with me.
Even today, it can be easy to forget that we're still living through this history. Lord hopes that more Americans will recognize the importance of recording their own experience.
I'd like to encourage your listeners to contact us to tell us their COVID-19 stories and to offer objects that they think represent their stories and their experience of COVID-19. We're still collecting around this topic. As I said, we'll be collecting around this topic for decades to come, but it would be really helpful to hear from people about what they think is important that we collect. This is a collaborative effort. We're historians, but we collect on behalf of the American people. So hearing from Americans is really important to us.
If you have a story that you'd like to share, you can find out more about the Smithsonian's COVID-19 collection and all of our guests by visiting our website, viewpointsradio.org. For more behind the scenes, search Viewpoints Radio on Twitter and Facebook. Our writer this week is Scarlett O'Hara. Our executive producer is Amira Zaveri. I'm Gary Price.
The number of people with dementia worldwide will nearly triple by the year 2050 to more than 150 million. The new data presented at the Alzheimer's Association International Conference 2021 shows fastest dementia growth in Africa and the Middle East. Dr. Maria Carrillo is Chief Science Officer at the Alzheimer's Association.
Positive trends in education levels are helping to dampen the increase in dementia, but total numbers are still going up because of the aging of the population, as well as the influence of more obesity, diabetes, and sedentary lifestyles that are all risk factors for dementia.
Another study reported at the conference finds wide differences in the Alzheimer's mortality burden in the United States. In the rural South, the Alzheimer's death rate is 3 times higher than the Mid-Atlantic region. Researchers say this could be the result of health disparities, including differing access to primary care and other health services. Find out more at alz.org.
Cardiovascular or CV disease is the #1 killer of adults in the U.S., and millions of people trying to reduce their risk of a heart attack or stroke may unknowingly be taking medications that are not proven nor FDA approved to reduce cardiovascular risk. Let's hear from cardiologist Dr. John Osborne.
Many people are unaware that after a failed outcome study, the FDA revoked the approval of fenofibrates when added to statins, as the risk outweighed the benefits to heart health. It's important to remember that statins, along with diet and exercise, can lower cardiovascular risk by about 25 to 35%, but persistent cardiovascular risk, which can lead to a life-threatening event, may remain. I would tell anyone still being prescribed fenofibrates, such as Tricor and Trilipix, with a statin, to talk to their doctor about FDA-approved therapies for cardiovascular risk reduction.
To learn more and get clear on the facts, visit itscleartomenow.com. Again, that's itscleartomenow.com.
And that's Viewpoints for this week. Viewpoints is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more about upcoming shows and find a library of past programs on Apple Podcasts, Google Play, and Spotify. Plus, you'll always find previous segments and more information about our guests at viewpointsradio.org. Join us again next week for another edition of Viewpoints.
Coming up on Viewpoints.
Space is something that gives us the opportunity to go someplace larger, see something grander than we possibly can see on Earth.
The billionaire space race. Then,
Western women, they consider themselves mainstream American women who were just taking advantage of the opportunities that the West gave them.
The real movers and shakers of the new frontier. I'm Marty Peterson.
And I'm Gary Price. These stories in depth on your public affairs magazine, Viewpoints.